Good afternoon, Lorenz, Middletown. Let's begin the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. Please start your OET-speaking roleplay.
Hello Mihiraa. It's nice to meet you. I'm Lorenz Middletown, one of the nurses here, and I'll be helping to guide you through some of the preparations for your thyroid surgery. The main purpose of this visit is to go over all the pre-surgery instructions to ensure everything goes smoothly. I'll also be checking on your current health status and your readiness for the procedure. Now, some patients feel symptoms like shortness of breath, difficulty swallowing, or neck pain related to the thyroid. Are you experiencing anything like that, or have any other symptoms been bothering you?
No, I haven't felt any issues. Is there anything I need to know about food restrictions?
I'm glad to hear you're feeling comfortable. Mihiraa, let's go over the instructions so you're well prepared. For food and drink, you'll need to stop eating or drinking anything after midnight the night before your surgery. This is very important to ensure the anesthesia works safely and effectively. If you're taking blood-thinning medications, those will need to be stopped in advance as they can increase bleeding risks during surgery. However, for most of your other medications, you can still take them on the day of surgery, but only with a very small sip of water. Mihiraa, before your surgery, we'll also conduct a series of preoperative tests to ensure your overall health and suitability for the procedure. These tests typically include blood work to check your blood count, kidney and liver function, and hormone levels. We may also recommend imaging tests like X-rays or ultrasounds to visualize internal structures. Apart from this, if you have any underlying health conditions, such as high blood pressure or diabetes, we may need to perform additional tests to monitor your condition and adjust your treatment plan accordingly. These tests are crucial for a safe and successful surgical outcome.
Okay, got it.
Excellent. Now, let's talk about a part of the preparation for the day of surgery itself. Mihiraa, on that day, will need to insert a small, thin tube called a cannula into a vein in your arm. This cannula will allow us to administer essential medications and fluids efficiently. While it might seem a bit daunting, the procedure is relatively quick and painless. You may feel a slight prick when the needle is inserted, but it's a necessary step to ensure your comfort and well-being during and after the surgery. The cannula plays a crucial role in managing your pain relief and administering anesthesia. It also helps us manage your vital signs and provide any necessary post-operative medications. By using a cannula, we can deliver these treatments quickly and effectively, minimizing any discomfort you may experience.
I understand the importance. And nurse, when will I be able to go home? Are there any requirements for that?
Good question, Mihiraa. After the surgery, you'll be closely monitored in the recovery room. Our team of nurses will keep a watchful eye on your vital signs, such as your heart rate, blood pressure, and oxygen levels. We'll also monitor for any signs of bleeding or other complications. Once you've stabilized, you'll be transferred to your hospital room. Here, we'll continue to monitor your recovery, paying close attention to your blood calcium levels, which can fluctuate after thyroid surgery. We'll also keep an eye on any side effects from the anesthesia and adjust your medications as needed. Our goal is to ensure a smooth and comfortable recovery. Only after satisfactory recovery, you will be able to get the discharge. I hope it is clear to you. Do you have any concerns or questions?
Nurse, I'm quite social, and I don't like the idea of staying in the hospital too long. I tend to feel lonely and even a bit down when I'm isolated. I'd really like to go home as soon as possible.
I completely understand how you feel, Mihiraa, and I'm really glad you've shared that with me. Being away from home can be tough, especially if you're used to having a lot of social interaction. Please know that you won't be alone during your stay. You'll have the full support of the medical team, not just before and during your surgery, but also after, as we closely monitor your recovery and provide care. We're here to make sure you're comfortable and supported every step of the way. In terms of visiting, you'll be able to see your loved ones during visiting hours, which are from 9 a.m. to 5 p.m. You can have up to 3 visitors at a time, so you can have some company during the day and feel more connected. We will absolutely do our best to get you home as soon as it's safe for you to leave. The decision to discharge will depend on how well you're recovering and how you respond to our post-operative checks, but we'll be monitoring you closely to ensure everything is on track. Your comfort and well-being are our top priority, and we'll make sure you're well taken care of while you're here.
Okay, that sounds more comfortable.
Now Mihiraa, to ensure everything is in place, are you ready to begin the pre-surgery checks?
Yes, you may please.
Thank you Mihiraa.